Okay, here I have a left radius. As you can see, the styloid process is pointing toward my thumb. On the radius I have the head, and just below that is the neck, and just below that is the radial tuberosity, which is a rough spot, and on the distal end you have the styloid process. Here I have a left clavicle. You can tell it's left because the acromial end points out with the smooth side up, and when you put it on your chest you can see that the clavicle goes out and then back in. Okay, so here I have a right ulna. You can tell because the radial notch is on the lateral side of the ulna where the radius attaches, and on the ulna you have the trochlear notch, which is the U shape, and you have the radial notch where the radius attaches, the olecranon process, and down here at the distal end you have the head and the styloid process. Okay, so here I have a right humerus. You can tell it's right because the head, which is right here, is on the medial side alongside with the medial epicondyle down here at the bottom. Just below the head you have the anatomical neck, and the other neck on the humerus is the surgical neck. You also have the greater tubercle and the lesser tubercle right here. You also have the bicipital groove, and on the back you have the deltoid tuberosity where the deltoid muscle attaches. And on the other side of the humerus you have the lateral epicondyle. Alright, here I have a right scapula, and on the scapula you have two borders, which are the medial border and the lateral borders, and they both meet at the inferior angle. Also on the scapula you have the infraspinous fossa, which is all of this, and you have the spine. You also have the acromion process and the coracoid process. Also have the supraspinous fossa and the glenoid cavity, which is where the humerus attaches. And lastly, the subscapular fossa. So here we have a right hand, and just below the pinky you have the hamate, and just below the hamate you have the pisiform, and over here at the base of the thumb you have the trapezium, and just below that you have the scaphoid. So on the hand, how you tell the metacarpals is the hand is numbered from lateral to medial, starting with the thumb. So on this hand, the thumb would be number 1, so here's number 1, 2, 3, 4, and 5. Alright, so just above the metacarpals you have the phalanges, and they're numbered lateral to medial, so your thumb is number 1 starting, so 1, 2, 3, 4, and 5, and numbers 2 through 5 are different from the thumb because they have 3 phalanges, which are the distal, middle, and proximal, whereas the thumb only has 2. Here I have a left pelvis, and the pelvis is broken up into 3 major parts, which is the ilium, the pubis, and the ischium. So the pelvis has 5 spines, and they are the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. And the last one is the ischial spine. The pelvis also has the iliac crest up here at the top, and also the hole right here is the acetabulum, and the ischial tuberosity is the rough spot down here at the bottom, and also this hole right here is the obturator foramen. Okay, so here we have a left femur, And on the femur you have the head, which is up here at the top, looks like a ball, and below that you have the neck, and you have the greater trochanter right here. On the back you have the lesser trochanter and the gluteal tuberosity where the hamstring muscles attach. So down here at the distal end of the femur you have the epicondyles, and on the inside is the medial epicondyle and the medial condyle, and on the lateral side you have the lateral epicondyle and the lateral condyle. So here we have the patella, or also known as the kneecap, and an easy way to tell left from right is you would set it down on the table, and if it leans to the left then it's a left, or if it leans to the right then it's a right. Okay, so here we have a right tibia, and on the proximal end you have the medial condyle, and on the other side you have the lateral condyle, and on the front of the tibia you have the tibial tuberosity, which is a rough spot, and on the distal end you have the medial malleolus. Here we have a fibula, and at the proximal end you have the head, and at the distal end you have the lateral malleolus, which is most commonly broken when somebody breaks or fractures their ankle. So next we have our metatarsals, and they're numbered from medial to lateral, starting with number 1, 2, 3, 4, and 5. So above the metatarsals you have the phalanges, and they are also numbered medial to lateral, starting with the big toe, and they have the distal, middle, and proximal phalanges, and numbers 2 through 5 are different from number 1 because they have 3 phalanges.